Thank you also. And now we move to the report from East Asia, and it will be given to us by Vo Tong Xuan, Director of Tan Tao University in Vietnam.
Thank you, Mr. Chairman. East Asia, although we are blessed with the tropical agriculture, and also we have a group, we have two countries which are the first and second rice export countries, but the other countries in East Asia also have to suffer a lot of from calamity. Therefore, they have to import the rice. But the widespread malnutrition was not seen as in South Asia. However, there's malnutrition, and this we have attributed it because although the government of all countries have policies and programs to tackle the nutrition, but because of the link between health people and agricultural people are not there, or not very clear. Therefore, we have come up to resolutions that we should say that now in order to overcome the malnutrition, the poor people have to access the food. And as the food here means we have the good food and good quantity and also safe. And in order to do so, we have the approach is to have the community-based approach. That means the holistic approach, wherein we have to the team of experts from different sectors that we working together in the education and training of the farmers to know the nutritional values of food, different kind of food, and from there to try to train them how to, or help them to how to grow their own food by this community approach. And in order to do so, we have to provide them with infrastructures, such as the land for them to grow, because many of them do not have enough land. Also, we have to provide them with some credit in order to work on this production. And the post-harvest technology have to be there also in order to preserve the quality of their food. And this we have to, must say that all this we have to give better attention to the women and the youth. Why? Because women are the ones who produce more men. And if they are not educated, then the womb in them and also the child, which is 2 years afterward, would not be very well raised. And therefore, that person, that future person, will not be able to live, to be intelligent. And then if that child is a girl, and she in turn will do the same. That means if we can give more attention to support and empower the woman and the young woman, the youth, in all this quality in the education for the food, for nutrition, I think that we can solve the problem of the malnutrition in East Asia. Thank you.
Thank you very much. And the next report will be on the session on Latin America and the Caribbean, and it will be presented by Daniel Balaban, the president of the National Education Development Fund in Brazil.
Thank you very much, Mr. Manfred. First of all, I would like to say that I'm a little frustrated because I would like to be present in the other sessions discussing the problems and solutions for Africa, for Asia, and for high-income countries. But unfortunately, I don't have a clone yet. I did. But in our session, we presented experiences and perspectives from Latin American Caribbean experts. For Argentina, we represented how the country has advanced regarding to the goals set by the World Health Organization in the document on the global strategy on diet, physical activity, and health. She showed us the problem of prevention of infection in Argentina that has contributed to the decrease of the risk of cardiovascular disease in the country, interaction by educational campaigns which contributed to the consumption of healthy foods free of trans fatty acids. The challenge now are optimizing foods, working with the agriculture sector, industry, and educational institutions. Peru, the country identified potential levers for agriculture from the public health perspective. The urbanization of population, which caused a series of diseases, the creation of indicators for monitoring success of the measures, and he concludes that the majority of public health professionals may be more familiar with the demographic and epidemiological transitions than the nutrition transition. From Brazil, we could see what has been doing in the last decade to fight against poverty. How works the Hunger Zero strategy in Brazil? Some of the most important food and nutrition security policies include improving coverage and quality of primary health care through family health teams, redistributing income, especially through cash transfers programs, as the Bolsa Familia program, which allows the access to food to basic social rights as health and education, stimulation of local agriculture, mostly through home-grown production, and the school feeding program, which covers more than 47 million students for free, and much purchase of the school feeding program, at least 30%, must be, have been from foods produced from local producers, small producers. He concludes that policies like education, agriculture, health, and social policies must be articulated and strengthened in order to focus their efforts and multiply their incomes, their outcomes, with strong monitoring and evaluation systems which can subsidize all sectors and stakeholders in policy and decision making. We also learned about the regional level and the framework of the Central American Integration System, initiatives, strategies, and policies that have been adopted in Caribbean with the participation of different sectors, including health, agriculture, education, and environment. The technical cooperation and assistance activities that are undertaken in the 8 member countries, Guatemala, Belize, El Salvador, Costa Rica, Nicaragua, Honduras, Panama, and the Dominican Republic, include support for the formulation, implementation, and strengthening of national programs and multi-sectoral health, agriculture, social protection, education in the private sector, and interdisciplinary national commissions to reduce chronic malnutrition. Within this, the final considerations of our session are that most poor people in the world feed their families and earn their income from farming. When farmers increase their productivity, nutrition is improved, and hunger and poverty are reduced. We must respect regional cultures, habits, climate, and foods, and the specific nutritional requirements of the populations, and improving access to healthier foods like fruits and vegetables. Policies like education, agriculture, health, and social policies must be articulated and strengthened in order to focus their efforts and multiply their outcomes with strong monitoring and evaluation systems, which can subsidize all sectors and stakeholders in policy and decision making. Policies based on the Brazilian experience like Hunger Zero strategy that improves cash transfers for poor families that must have children in school and keep their vaccinations up to date. These children receive school meals that are provided by the state, and the state must buy the meals produced by small farmers, which in turn are able to feed their families, consuming goods, and boost the local economy. This is a virtuous cycle. Well, Albert Einstein used to say that if you always do the same things, you always will have the same results. So, if we want different results, we may change. I think that the circumstances have led the world to a critical decision. Either we begin now to work in a new perspective, or, unfortunately, it will be too late. Thank you very much.
Thank you, Daniel. And the last report now comes from a session on high-income countries. So we know that is not a region of the world, but I think the generic description is the OECD countries, which I assume to be high-income countries. And I invite my countryman, Professor Heithus, from the University of Stuttgart-Hohenheim in Germany, to give the report.
Thank you. I want to report on this high-income country session and the perspectives on the issue of agriculture, nutrition, health, complex, and linkages. I want to address and highlight 4 points. The first one is agriculture systems and agriculture policies in high-income countries have not been explicitly focused on nutrition and health aspects, quite opposite. They have focused on productivity increase, on price policies, on income, income securing, adequate income security for farmers in the EU, particularly with trade restrictions, export subsidies, policies that have triggered an enormous amount of controversy, have led to enormous distortions and resource waste. They also have led to contradictions in lack of coherence in agriculture policies and development cooperation. So I'm not so sure that there is so much to adapt from those experiences. Secondly, it was emphasized we need to formulate better policies that take into account the linkages, agriculture, nutrition, health. We need to have a better understanding how these linkages work in detail, and that requires more research. But not only more research, also a change in direction of research approaches. Number one, a change in direction that has been mentioned here quite often, the multidisciplinary, holistic approach to research. Easier said than done. Secondly, a change more in the direction of using and integrating local knowledge, and that requires participatory research approaches. In other words, the poor single mother farmer needs to become not only the topic of research, she needs to become part of the research process. Also, not an easy task, quite a challenge for research. Number three, the panel discussed quite intensively the risk issue. Risk to food security, to nutrition and health are likely to increase. Some people would say are certain to increase with climate change. It was emphasized that there is a need for being better prepared to cope, to manage risk and to cope with risk and to mitigate risks. Those approaches certainly need to be country and region and maybe even situation specific. So there's a lot of work on research in that field. Part of the risk situation is also the volatility of market that was addressed, an issue that is very difficult to handle because food markets are by their nature, because of these low elasticities we are dealing with, by their nature volatile. So the only way to approach the volatility issue is by, we cannot do so much to address the causes by addressing policies or measures that smooth out those fluctuations. It is an urgent task because the volatility has led to countries imposing export restrictions that is creating distrust in the functioning of the world market, and that may spread as a disease, and the costs would be extremely high. Number 4, effectiveness of nutrition policy. It was emphasized that it's absolutely vital to get away from the patchwork, fragmented, isolated interventions in nutrition. What is needed is a multi-sectoral and multidisciplinary approach to both, to research, and we need to, in research, get away from looking at individual interventions, but look at why people make the choices they do. Why do they behave the way they do? And perhaps going beyond the choice of foods to the whole lifestyle issue and its impact on nutrition. Secondly, the multi-sectoral approach to implementation. My time is over. We have discussed the multi-sectoral issue in a number of sessions. It's a difficult task to get different line ministries in implementation, to get different line ministries to cooperate in a coherent way. Thank you.
Thank you very much. I think these reports from the regional sessions have shown that we have a great degree of variety of challenges and issues, particularly between poor countries and the higher income countries. But at the same time, we have a high degree of interaction, interconnectedness on the global food markets. And let me just mention the word of bioenergy and the issue of foods or bioenergy, which immediately points out, I think, to everyone here how interconnected these are. I want to thank all reporters very much for their very short but yet very rich reports. And if I may, I want to leave you just with one thought that I take away from these reports. And that relates to the issue of sectors. Or we've heard the word sectors and cross-sectoral and intersectoral a lot of times in this session. Isn't it so that sort of our allegiance to sectors is actually a professional deficiency that all the professionals here in the room have? If you go to the people that we work for, to the mothers, to the local administrators, they don't know much about sectors. They don't live in sectors. If you go to a mayor of a small town, he will not be able to talk about sectors to you. If you ask a mother, in what kind of sector are you living in, she will not know any answer. She will not be able to deal with the question. So I think the people that we care for really do have a very cross-sectoral list of issues and cross-sectoral list of responses. And sectors are sort of the way that we professionals organize our world. So by working cross-sectorally, as we need to do faced with a new issue that we take up like nutrition, by working cross-sectorally, we are just sort of trying to correct or to compensate for that professional deficiency in order to come to the level of integration where the mother or the mayor, the local mayor already are. So I want to leave you with that thought that you may be able to take home. Thank you very much.